All right, let's go ahead and start talking about how to study, aka how to survive nursing school. I've adapted the document that I posted on the Success Nursing page about how to study to a PowerPoint just to kind of explain some of these things a little deeper. Most of this should be in the document if you want to read through it, but I know some people are more visual learners, so let's start talking through some of these things. So, just a couple disclaimers here. First, I'm not an expert on this, so I am someone who has been a lifelong learner. I've gotten multiple degrees, I've nerded out, so I've learned kind of what works, especially what works for me. I've talked to many students and kind of seen your guys' experience, and this is just a PowerPoint to try to bring some things together. Hopefully, you find this helpful. If you don't, that's okay too. It would not hurt my feelings if you told me I was wrong. This is just what my experience has been, and hopefully you find it helpful. I also like to let people know I was in your shoes not too long ago, so I also had that struggle where I had to work 36 to 40-hour weeks while in nursing school, so I would have clinical all day and then work a 12-hour shift all night, so I know the struggle. I know it hurts. I know that it's easy for me to come here and say this, like, yeah, do all these things, and you're like, yeah, but when do I have time? It's not going to be easy, but I'm telling you it's going to be worth it. So just know that I'm not coming from some moral high point. I know that struggle of not enough time in a day to get anything done. Um, and again, this may work, this may not work for everyone, but something in here hopefully will be helpful to you and will give you some guidance to maybe improve your test scores or do better than what you were doing before. And if nothing else, even if you don't improve your test scores, maybe just to better understand the information. Our goal here in nursing school is not to beat you to death with this information, but we want you to be able to be safe and effective. So just know that anything that we can do to help, that's what we're here for. So there are officially, and this of course is me, non-expert, what I've made up. I kind of broke down the phases of studying into 5 phases. So first there's pre-reading, then there's class reading, studying, and teaching. And we're going to break down each of these into um, each phase and kind of talk a little bit more about them. So phase one is going to be your pre-reading phase. So most people are going to be like, oh, what the heck's pre-reading? I already do enough reading. I don't want to add any more reading. I feel you. But pre-reading is not the same as regular reading. Pre-reading is where we go in before class and start to skim and, read the headings of kind of like getting ourselves prepared for what's to come. And when we're pre-reading, what we want to be looking at is we want to be kind of answering these questions in our head, just very basic level. What is it? Who's at risk for it? How will we diagnose it? How will we treat it? And, what can I do as the nurse for this client? Those are effectively what we need to know for every disease process. Now, do you need to pre-read and know all of these things? No, but these are the things you start trying to pick out of the reading. These are those really important pieces. And when you're reading, be looking for certain words, like if something says this is the golden standard, this is the most common, this is the most deadly, this is the most serious, those are like the words that you want to kind of stick to. You want to start figuring out what makes something different from other things that you're reading about. So what should you be skimming for as you're skimming? If you don't know, if you're like going in and let's say you're going to be learning about gout, you know nothing about gout. So start by reading, usually in most textbooks there's going to be an etiology, pathophysiology section. Just skim that real quick. Try to get an idea. Pick out some key words of what this has to do with. Again, we want to know what's common and then what are the warning or deadly signs. That's going to be under your clinical manifestations. We can start looking a little bit about treatments, like what are we going to do for this under interprofessional care. And then we can also, there's usually like a tiny list under nursing management, nursing diagnosis that kind of talk about the priorities. Like, is it airway? Is it, nutrition? Is it fluid balance? Like, what am I worried about with this patient? While I'm skimming, what should I be doing? Preferably nothing, just reading, taking it in. And like I said, we're not here to try to know all this information before class, but when your teacher starts bringing these up, you can start connecting those dots, be like, oh yeah, I remember now, that disease is the one that has this weird thing, or this is what's different about it. And if you feel a need, because a lot of people like to write things, if you want to write notes while you're doing it, you can. But keep in mind, when a lot of times when you're writing, you're not always reading. You're more focused on the writing. So try not to get too overwhelmed by that. At the end of your pre-reading, if you want, what you can do is like going back to my gout example. You could say, okay, what did I learn about gout? And summarize everything like that you read in that section into 1 or 2 sentences. Just real quick summary. The big things, like I said, common and deadly, just kind of focus on those bigger concepts, and that way you're going into class with some sort of idea of what the teacher's going to tell you about. And again, not every detail, just figure out what's different about that. So especially if you're learning about a bunch of different disease processes, you want to figure out, what makes this one different than the other one that I just read about. So let's do an example. So here's a excerpt from the Lewis MedSurg textbook that's talking about arthritis. So if we had all of this, and this is what we were going to skim to read before class, there's a lot here. So it's like, well, how do I, take this? So why don't you take, a few seconds, just kind of read it if you can. I know that the prints might be a little small, but try to just look over this real quick and see if you can pull out any keywords or what is standing out to you if you had to write something about osteoarthritis. So, for me, a good way to summarize this would have been to write something like OA is a type of arthritis without inflammation that happens to older people. And that really, really slims it down. Some people might do something. They're talking about the 30 million Americans. All the different ages, because it was talking about different ages that people start feeling it. But those details, while they may seem important at the time, at the end of the day, what's common, what happens to older people, and what makes it different. This type of arthritis, if you remember on that last page, it said that most arthritis is inflammatory. This one is saying this type of arthritis is without inflammation. So to me, that kind of differentiates it. It makes it a little bit different. So that's the kind of thing. And, then there's that whole list of all the things that could cause it. Well, memorizing a list of all the causes of a possible disease process is not going to help you. Most of the time as nurses, when we're sitting there, we're not trying to, play detective and figure out like, okay, of the 15 to 20 things that could have caused the patient to have this disease process, which one is it? Most of the time we're focused on care. How can we improve their symptoms? What can we do to make it better? Also, while you're pre-reading, it's good if you're writing down questions, things that you don't understand or that don't seem to make sense to you that you're reading. Don't read something 50 times. If you're not getting it after reading it 1 or 2 times or skimming through it, write down the question and then see if later that you're able to answer it after going to class. So, what if you're one of those people, which, I was this person too? What if I feel like everything is important? And I'm here to tell you it sadly is not. So, as the nurse, you need to be focused on what the nurse will be doing. I know myself as a student, I would sit there in my head and I would be like, okay, well, I would read something and I'd be like, okay, I can see this written as a question. This is how they're going to write it and they're going to trick us and this is what they're going to do. What would we do? Would we do this or that? And I would get so worked up and anxiety prone in my head just thinking about all the possible questions from all these little details, or, oh, this sounds weird. I bet the teachers are going to put this on there. And guess what? They 99% of the time did not. We really want you to focus on what to expect. As the nurse, what kind of orders you might be expecting, what kind of care you should be giving. And again, what are you commonly going to see? And then what are going to be signs that something's not going well? Something's going down into the toilet. You need to fix it. It's really looking at those two, they're very, very opposite, but those two things are really going to tell you a lot about a disease process. So phase 2 is going to be coming to class. So not just coming to class, but this includes think tanks, enrichment sessions. I know not everyone can make it to them, but if you can, it's great. That can be really helpful, and it helps to learn from different people. You'd be amazed that, sometimes you're, learning, something from someone, and it's just not clicking, and then you hear it from someone else, and it's like, oh, that makes sense. And everyone learns a little differently, so it's good to get this information from different people. That repetition is key. Even when you think you're not learning, trust me, you're learning. It just hurts. Learning is uncomfortable. It's not easy, but that repetition is key. And so as much as you may think, oh, this class isn't really helping me, blah, 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 you might not realize just how much you're learning. Maybe you don't hear something from your professor that makes sense, but maybe the person who's sitting next to you says something. Maybe you do an activity that helps you to remember something or gets an idea in your head. Participate. So just sitting in class and listening will not get you anywhere. So no one wants to raise their hand because everyone's so afraid of being wrong. And it sucks to be wrong, doesn't it? But I've got to tell you, just sitting there and having the answers in your head doesn't help you at all. Because you know what? You might have the wrong answer, but you're not going to know it's wrong if you don't try to ask it. Does that mean you need to give every answer? No, you can let other people too. But try, giving an answer, because remember, you did your pre-reading, so hopefully you might have something to add to the conversation. And if you give the wrong answer, guess what? You're going to learn why it's the wrong answer, and then you're going to actually better understand that information. And no one cares that you're wrong. No one's looking at you, judging you. Everyone's there trying to learn. Everyone has anxiety. Everyone's freaking out. Everyone just wants this process to be over. But something you say, someone else in that room could be thinking the same thing. And because you said it, because they didn't have the guts to say it, they learn too. So just keep in mind, it's not just about you. You'd be amazed at what you can learn. And then same with other people. Other people may give a wrong answer, but it helps you. So don't be afraid to participate. Ask questions. So, at the end here, I have answer your questions from your reading. So bring whatever questions you got from your reading. And if there's any that you weren't able to answer after doing your reading, try to see if you can answer them by the end of your class. If you can't answer them by the end of your class, then go up to your professor or email them after class and try to see if you can get the answer. But this is the thing. If you try to think first, let me put there, try to make an effort first to figure out what the answer is. Because as much as it may seem like, oh, I have no clue what it is, have you tried thinking about it? What makes sense? Go to your professor with a formulation like, I don't know if this is the correct answer. Here's what I'm thinking. Because that's a lot better. We're not here just to spoon feed you and tell you like, hey, you have a question. Here's the answer. Sometimes that's going to be necessary, but really we're trying to teach you how to think. We want you to get this process yourself because we're not always going to be there for you. We want you to be able to take, the skill of learning and use it on your own. And so sometimes it's kind of hard. Sometimes it's like, I just want to know the answer. And trust me, we want to tell you the answer. It's not that we don't want to help. It's just that we're not helping you if you're not learning how to learn effectively, how to get this information. So try to really think through that process, what it could be. Maybe you're horribly wrong. Maybe you're on the right track. It doesn't matter. You're trying to think, and that process is so important. Also in class, while you're listening, make sure that you're focusing on big concepts and not every little detail. So if you're like me, who had like those notes that would be like an entire page and every little corner and box was filled in, that's not going to help you, because how are you going to figure out what's important and what's not? I know some people feel like they have to write down every single thing that their professor says, and maybe there are some professors out there that literally word for word everything they say is on the test. That might be true, but are you really getting in the information if you're writing down every detail? This is a great way to start practicing that learning process. Like, listen to what they're saying and try to take the important parts out. And that might mean maybe if they'll allow you to record them, so if you missed anything you can go back later, but really try to focus on what they're saying and try to pull out again what's common, what's deadly, what's different about this disease process. So how do we take purposeful notes? Effectively, we want you to have the information that's going to help you to provide safe and effective care. Again, do not try to fill out every inch of your page. I kind of already touched on this, focusing on what's common, deadly, and different. Another thing that you can do is take notes and then compare them to someone else's notes after the class. Maybe compare them to the person sitting next to you, or maybe if you do a study group later that week, compare and contrast what you wrote versus what they wrote. Maybe they picked up on something that you didn't get. Maybe you wrote down something wrong. Maybe there was, a confusing concept, but it kind of helps you to see how your note taking is doing. Anytime we're learning, we have to constantly be looking is like, what am I doing? Is what I'm doing working? Is the way I'm studying working? So a great way is to, compare notes after class, see what other people wrote down. What did they think was important? And again, like I said, remember to listen. There's people think if they write down everything that they'll have the answer somewhere, that somewhere in all that their teacher said that day that there's going to be all the answers. But most of the time, there's a whole lot of extra stuff thrown in. So active listening skills are so important as a nurse, and then also on this journey as you're trying to figure out what is important. So the next phase, phase three, is going to be reading. So this is a deeper reading. So this is deeper than reading the headlines and just skimming. This is going to be an actual like reading through each section. You don't need to spend hours on this. Honestly, when it comes to, and I should back up and say, with like pre-reading, you shouldn't spend more than like 30 minutes to an hour doing any pre-reading at a time. Now, if there's a lot of reading for your class that week, you can do 30 minutes to an hour, take a break, do some more that afternoon, take a break, do some more that evening. But you shouldn't be sitting down and doing any activity that involves studying for greater than an hour, hour and a half, because you are going to get so burnt out, and at a certain point, you're going to stop learning. It's better to space out your learning activities. It also helps to see how much that you're actually keeping, remembering and keeping in as you're going back to the reading in the book and things like that. So when we do this deeper reading, we really want to be, kind of just picking out some more some of the little details, and important parts that may differentiate. Again, you're still looking for the same thing: what's common, what's deadly, and what's different about this disease. Try to do some of the reading on the same day. Like, try. You're not going to be able to do all of it. Like I said, do not sit down and read for more than an hour, hour and a half at a time. You can read multiple times for an hour, hour and a half in a day, but don't do it more than one sitting. If you're studying for 4 or 5 hours reading the book, you gotta quit that. That's one way to get yourself burnt out real quick. But there's a certain point where you stop taking in the information. So it's really better to space out and do little bursts of study sessions. Um, so while you're doing this deeper reading, another way to kind of get in this knowledge is to fill out the concept map. Uh, and by filling out the concept map, you're kind of like, organizing the information in your brain and putting it on paper. The best way as you're studying and like as I'm going through this PowerPoint is look that there's so many different ways to study. You don't need to do all of them, but start trying something different. Maybe with some of your reading, do a concept map. Maybe with some of it, make flashcards. It doesn't have to be a concept map, but it's just writing it out, like doing something different. You're reading and then you're putting it on paper, and it might depend on what kind of learner you are too. So scaffolding, if I've lost you here because you're like, what in the heck is that? If you're already Googling it, feel free, go ahead. Scaffolding is effectively taking knowledge that we already know and applying it to something new. So this would be, for example, when I became a mom, like me taking stuff I learned as a nurse and applying it to taking care of a baby. That's me scaffolding. I'm taking something I already know. I already know how to change an adult's diaper, and so I know some tricks and tips for that, distracting them and things like that. And so I'm going to take that knowledge and I'm going to apply it now, having a child to do that. But you should do this in your information too. When you're reading, you should be looking for, what as much as we want to see what's different about this disease process, also see if you can connect it to something you already know. So the example that I gave in the packet was like about how, like if you already know about hypertension or high blood pressure, then when you learn about glaucoma, it's just high blood pressure in the eye. So you're taking something you already know and you're applying it to a new condition. But that helps because then, hey, okay, if this is high blood pressure in the eye, what medications am I going to give? Beta blockers, alpha blockers, etc. You're going to give the same kind of medications, except it's for the eye. So a lot of times you can apply something that you've already learned in one class to something else. And you shouldn't just be reading. So, if you're done with class and you're like, okay, well, I'm not on to phase 4 yet. Guess what? You can do phase 3 and 4 simultaneously. You're going to get so tired of reading. So do a little reading, do a little studying, do a little reading, do a little studying, alternate back and forth. Phase 4 is the studying phase, and of course this is the fun part. There's so many ways to study, and so I'm going to go through some of these. Obviously, figure out what works for you, and I know I said in the last slide, like, hey, you got to stop doing that. If that's working for you, whatever. If you're watching this and you're like, hey, my testing's pretty good, I just want to see if I can improve it anymore. If you've got a good thing going, keep on doing it, but maybe you can learn something new or different, or maybe if you're like advancing in the program and you're finding that, hey, the way you studied before worked for one class, but now it's not working for the next. Maybe this will give you some ideas for different things to do. So some things we're going to talk about on the next slide. We're going to talk about brain dump, but flashcards. Flashcards are great for studying meds, labs, things like that. They should not be long and detailed. You shouldn't have more than just like a couple words on both sides. A couple words, a phrase, nothing too long. They should not be like the whole flashcard filled up. Worksheets. Your instructor might give you some of these. We're going to talk later about how you can create your own. There's a lot that are available online. If you like Google nursing school resources, there's a ton of stuff out there. But yeah, you want to just start kind of looking at this information a little differently, trying to apply it, because you can read all day long, but until you learn to apply this information, it's not going to be helpful. So let's talk about what a brain dump is. So a brain dump is, and this is just the concept map that I have for my lecture. You're welcome to just brain dump on a piece of paper. This is where, like, okay, so I've done my pre-reading. I went to class. Um, I've done the reading in the book, and now I want to see, like, how well did I actually get it. Now, usually this is not something you're going to do right after you read the information. You're going to do this like the next day, or maybe like give some time in between from when you read or took in the information. And you're just going to write down, without using like any notes, anything else to help you. You're going to write down everything you know. So let's say like I'm going back to gout. So I put gout down here, and then I'm going to put everything I know. Then what I'm going to do afterward, and remember, not using any notes, I'm going to look and see where the holes are. Maybe I know what it is, what labs to do, what physical assessment, but I have no clue what I'm going to do as the nurse. Well, that means I need to go back and read the nursing section for gout. So instead of going back and rereading the whole thing and saying, oh, I don't really know gout that well, I'm going to just focus on what I still didn't know. I'm trying to figure out where my holes are to that I need to still study. What am I missing? Like, where is it? What am my thought process got interrupted? And you can do this, at any point. And maybe if you already have information about a disease process pretty well, then you could do this before you do some reading and kind of see what you already know, and then tailor your reading to what you don't know. But there's not enough time to study everything. We cannot read everything. So we really want to kind of focus on what we're still not understanding. There's, of course, lots of more ways to study. There's videos. I'm listing some that I have used and I've heard students using that have found them good. A lot of people are visual learners, and sometimes it just takes seeing it or thinking of it as an analogy or as a picture. YouTube has a ton of other videos and resources as well. Practice questions. So there's 2 points for practice questions. Excuse me. The first point is going to be to, of course, like learn the content. Like I said, you have to be able to apply this information. You can read all day long, but if you don't really know how to answer a question about something, no amount of knowledge is going to help you. Because remember, once you're an adult, you're at like 75% application, and when you get to complex, I think it's up to almost like 90% application. So you really want to make sure that you know how to apply what you're learning to situations. And the second thing is you need to practice testing. Testing in itself is so hard. I'm going to talk about test anxiety on the next slide, but keep in mind that practicing testing and that testing environment, all of those things can be so helpful, because maybe, if you're that person who's been studying, feels like you know everything, but you're still not doing well on the test, maybe it's something about actually testing. How many practice questions have you been doing? As professor, before I counsel someone for exam counseling, I always want to look and see, how many practice questions have they done? Have they leveled up on their EAQs, things like that? Because on average, you should try on most days to do at least 15 to 20 questions a day. And I know that sounds like a lot, but some of these aren't going to take that long. That should take you hopefully less than 30 minutes. And it was really going to help you, like I said, not only to better understand the information, like read the rationales. Maybe you'll learn something that you haven't read yet or you missed. Maybe also you're just going to learn some test taking strategies, because remember, half of nursing is the battle of learning how to take a test. So most of the time, like when you're first doing your practice questions early on, like the first week or two that you're studying, do them in study mode, look at the rationale, go in deep. But when you get to the point where you're going to be you're going to be taking your test soon, you want to go into exam mode. Most people don't do this because they're like, oh, I like to see the rationale. Well, of course you do. But is that really helping you when you need to practice testing? So when you get to the point where it's time to practice and get ready for the test, you need to keep in mind that you need to be in that exam mode where you can really feel that heat. And you should try to do like 60 questions. Most classes have 50 to 60 questions, question exam. So you should be practicing in the actual kind of environment, feel, testing environment, especially doing the online questions like we do at school. You should practice that environment because it's completely different. Some people, they do great. They're sitting at home doing practice questions, they get them all. but then they're sitting in front of a computer screen and something's throwing them off. So that's why you really need to practice. Um, so resources for practice questions, there's a ton of them. There's the Evolve EAQs, which are the adaptive, like you can keep leveling up, and as you're answering harder questions, you get harder questions. HESI Evolve has a bunch of other just practice questions, practice tests. Some people buy UWorld or the Nursing Academy, Registered Nurse RN. There's also questions in the back of your book and on your Evolve HESI textbook resources. And there's a ton of just books that are made specifically to just do practice questions. So feel free to do these too. Let's talk a little bit about dealing with test anxiety. Like I was talking about in the last slide, when you have test anxiety, it's a real thing. It is horrible to have test anxiety because you can know all the information, you could have done everything right, but then you sit there in front of that computer screen and it's like you lose it all. So some tips that I have if you have test anxiety is, of course, again, to simulate that testing environment. When I say that, I mean every part of that testing environment. So I mean, go into a cold room, take off your jacket, have someone close and open doors or make a bunch of loud noises, use the bathroom like in the middle of your test, do that test in exam mode on a computer just like you would, and really practice all of that environment. And as you start to, deal with the anxiety doing it at home, you can start kind of figuring out, well, what can I do to combat this? So one of the things I did, because I had horrible test anxiety when I was in school, and I would sit there and measure my pulse and be like, oh my goodness, my heart rate's 125, what do I do? So one of the things I would tell myself is, you know this stuff, you love this stuff, you can do this stuff. And what that is that's my mantra to kind of help remember like why I'm doing this in the first place. So it's not that you have to love, when I say you love this stuff, that doesn't mean you have to love all of it. What it means is, in the long run, this is a stepping stone that you need to do to get to the stuff that you love. So, for example, I'm not a big OB person, never was a fan of the class. It's just not my forte. But when I sat there and I was like, I've got to get through this class in order to, do what I want to do. I've got to know this stuff, love this stuff, and, believe that I can do this stuff. And so I would sit there after measuring my pulse, take a couple deep breaths, say my mantra a few times, and then keep moving on. And it's not easy. It's not some simple, but it's one way that you can start to kind of look at how you can combat that anxiety. Another thing some students find helpful is the power pose. I do this with my students before every class. I sit there in the Superman pose, or I should say I stand in the Superman pose. But any sort of powerful pose, research has shown that if you stand in a powerful pose before you're doing something that's really important, like a job interview, a test, etc., that it actually can increase your confidence and performance in yourself. So even if you're laughing at yourself, even if you're like, oh my goodness, I'm so pathetic, I have to make a weird pose in order to not, have a panic attack, that's okay. I'm there doing it with you. There's some people that can go through a test with it's easy breezy, and that's great for them. But I'm sitting there with you, sweating like bullets, and trying to, just get my heart rate under 150. So the power pose has made a big difference for some students, from what I've heard, and I have started using it in things that I do and found it very helpful. And then, at the end of the day, if you need help, whether it be counseling, medications, other things, we do have a nursing counselor. Their information is here on this page. Feel free to reach out to them if you feel that your, anxiety is beyond just testing, or if it's just out of control and nothing is working. We're here. We want you to get the help that you need. So here are some even more ways to study. There's case studies, which you can find on HESI Evolve. There's a ton of them. There's also case study books. You can find a study group, and study groups are super helpful. A lot of people, I understand, maybe your schedule doesn't work out right. You don't have to meet someone in person. Meet them over the phone, online, even in through text or some other chat. But get together with someone and bounce ideas back and forth, quiz each other, talk about like what you learned in class, talk about what you're not understanding, teach each other. I mean, the possibilities are endless for study groups. But find a group that you feel like you can be productive in. This is not a popularity contest, but find people that you study well with. When it comes down to it, at the end of the day, you don't have to be someone's best friend, but if you study well with them, that's all you really need at this point. So, find people that you really, can click with, and that can be hard. It can be hard to kind of find someone, but maybe, when you're going to think tanks or when you're in class, kind of feel around a little bit, see if anyone else is talking about getting together, meeting up, and then maybe, kind of take those first steps and, get out of your comfort zone. It's not easy to ask to study with someone. It almost feels like you're asking, someone out on a date, like, you want to study together? But, in the same right, like I said before, it's whatever it takes, to get through this process. So sometimes we're going to have to do what's uncomfortable, because guess what? When you get out in the real world, you ain't a one nurse show. You're going to be asking for help from people, whether it be other nurses or assistant personnel, wherever you may be working, you're going to need help. It's great to practice getting help. It's even great to practice working with people that you might not even like that much, because guess what? A lot of being a nurse is working with people that you might not always get along with, but you need to learn now, how to get out of your comfort zone. When it comes down to it, if you have a really big concern about your patient, are you going to just sit there and be like, oh, I'm too scared to go ask someone? No, we have to we have to take care of these patients. We have to ensure their safety. So it's a great place to start is by getting out of your comfort zone, find a study group. Visual resources and pictures. So like this picture on the slide is from those Mobies memory note cards. A lot of people buy these. I find them very helpful. I'm a visual learner. There's a ton of other visual resources and pictures. You can even just Google. So like a lot of times if I'm looking for a picture, I'll Google like whatever the disease process is or thing I'm trying to find, and then put the word nursing afterward, and then usually a lot of pictures come up. Other resources, there's the Clinical Key, which you might have bought with your textbook and not even realize that you have it. This is a great resource. It has journals, skills videos, and a ton of other stuff. Some people will pay for resources like the Nursing Academy, Picmonic, Simple Nursing, Registered Nurse RN, Khan Academy, etc. There's never an end of things that you can buy, but I'm also here to tell you, don't buy them all. Find one or two that work for you, and most of these will allow trials, so you can try them out, and then if you like them, then you can purchase the ones that are working for you. Do not spend all of your money. So last but not least is phase 5, which is teaching. And we don't really know if we know something until we try to teach it, because this is how, a lot of us, novice instructors feel like when we're sitting up there, we're like, oh my gosh, how did I go from taking care of patients to having to tell other people how to take care of patients? How did I get here? And so it can be hard. And sometimes, I can read something and I'm like, wow, I've got this down. And then I'm standing in front of my class and all of a sudden it's like it left my head and I'm like, but I read this. And it's because I didn't practice teaching it. I thought I knew it because I read it. And this is where you guys get in like the exam where you're sitting there and you're like, I studied for like 17 million hours. How is it possible that I'm, not remembering this? I have to it's somewhere in my brain. And the thing is it's not. You never transferred it into that long-term memory. But a great way to transfer into long-term memory is to teach it. You don't really know if you know something until you try to teach it. And so, effectively, the kind of pattern you can get into is practice teaching someone like in a group. It doesn't even have to be a person. If you're just like, I'm not talking to anyone else, fine. Find a plant, find a cat, find a dog, find a book. It doesn't matter who it is, your bed, a doorknob, but just teach someone, talk out loud and teach them these things. What is this disease? Who's at risk for it? How will we diagnose it? How will we treat it? What can I do as the nurse? Teach it like you have to say it, but I'm talking about without your notes. If you'll notice, almost all of these things you're doing without your notes. You need to always start with without your book, without your notes, because you don't know what you don't know until you're sitting in that test, and then realize, oh my gosh, I don't know this as well as I thought I did. So you should kind of get into a pattern of teaching, then going and filling in those gaps, kind of like with the brain dump where we go back and we read and study to kind of figure out what we're missing. Then we can also kind of fill in those holes, figure out what we're missing, and then we're going to teach and then repeat. What do I teach? Like we kind of talked about this, you're going to be teaching like just the basic things. Remember what's common, what's deadly, and what's different. Even if you just want to start with the basics. Other ways that you can teach, you can write your own test questions, write your own case studies, write your own worksheets or activities. You don't realize how hard these are to write, especially writing your own test questions. I know that everyone hates nursing school exams. Try to write out a nursing school exam question. You'll have some fun with it. It's not as easy as it looks. And by writing a question or writing a case study, you're going to figure it out. Excuse me. You're going to figure out, what not only what the correct answer is, you have to figure out what's the wrong answers. So you're going to have to think really deeply. And a great thing to do is for you and your group like to each pick a topic to write some test questions about, and then swap them, and then like do each other's questions, and then see if you can answer them, and talk about them afterward. But it'd be a great way to kind of get it. But these things are going to take time, but you will not believe how much you'll understand something better after you practice teaching it. So let's look at a few more other key tips. Like I mentioned before, we do not want to study, do any sort of reading or any other activity for more than 1 to 1.5 hours. At some point, we're going to stop learning. Now, if you're doing this, you're studying for 6 hours straight and it's working great for you, keep on doing it. But for most people, it's not really helping. And at some point, you're missing out on information. If you're someone who's like, well, I only have, these 4 hours, I can't spread out my time, that's okay. Well, you know what? At least what you should do is mix up what you're doing. If you're doing a little reading, do that for 30 minutes, then do an activity, then go back to your reading. Try to mix it up. Don't do one activity straight. It's best to kind of break up your day and really help that information be able to move over into that long-term memory. Mix it up, try different things, try something you've never tried before. The uncomfortable is a good thing. Sometimes when we're uncomfortable, we don't like it, but we may think this is not going to work for us. I tried it that one time and it didn't work. Well, maybe it didn't work on that one test, but maybe it's going to be really helpful on this other test. So be willing to mix it up. The thing I talked about earlier, ask for help, but try to figure it out yourself first. So, I know all students hate and, get so annoyed when, they ask a question to their instructor, and their instructor's like, well, what do you think? And they're like, oh, why won't they just tell me? Trust me. It's a long, horrible process to get used to having to wait in silence for someone to have an answer. It's not fun on our end either, but we're not helping you by just telling you, oh, here, let me tell you the answer. We want to, again, I'm going to reiterate what I said before, we want to teach you how to think, and you're going to need to be making decisions on your own as a nurse. So we really want to help try to get you there. So as much as you find it frustrating, okay, we'll take that frustration, that anger, and put it into thinking about what the answer to your question is. And if you don't know it, we're going to help you out, but we want to teach you how to think. We don't want to teach you how to rely just on us. Yes, there's going to be people in the hospital that are going to have more experience with you, and you may rely on them for some answers. But there's going to be times where you don't have someone to lean on. You're going to be the person in that day. Trust me, it's so scary the day that you're the person who knows the most on a unit. It's definitely no fun. Or you're like, oh my God, how did I get here? But one day that's going to be you, and other people are going to be looking to you for answers. And then, really you're going to have to be able to make those critical decisions on your own. Some people do color coding where they color like certain disease processes, drugs or meds or something like that. They color code them. Some people find that that's helpful, especially if you're a visual learner. Make sure to check all your sources. So, I told you about all these websites, sources, and things that you can use, and a lot of them are super helpful, but keep in mind, they're not your textbook. So, and when it comes down to it on the test, our legal protection is your textbook. So if you're ever seeing something, maybe you're doing an EAQ, or maybe you're using an online resource that you bought or another book or something, and there's some that's contradicting what your professor said. Usually we're going to go by what your professor said, but just reach out to them and say, hey, I'm hearing different things, am I misunderstanding something? This was my understanding, because you always want to make sure that you know the correct information. At the end of the day, your main source should be your textbook. And we're not saying that these textbooks are perfect. They get updated, and it's always great when they get updated with current information. We're always behind practice like 8 years, but always make sure that you have those sources checked, that you're making sure that you're using something that's reliable. Do not try to do it all. So I just told you about like 50 different things you can do differently. Don't try to do every single one of them. Do small tweaks, for your next test. Try a couple of these new things, or mix up your schedule a little bit, or try to space out your studying. Do something a little different, but don't try to do it all. You don't need to do every single one of the ways that I said to study. Just try a few of them, and mix them up. Find what works for you. And maybe one test you're going to need to do a lot of flashcards, but then the next test you need to do more case studies. It's just going to depend on what you're learning, but you can't do everything. And also, like I said before, don't spend all your money on a million different resources. It's way too expensive. take accountability for, your test scores. It sucks to have to go to a professor's office and be like, here's what you did wrong. Because, in our heads, I remember being that person like, well, I can see my role, but at the same time, those questions that were really tricky. And maybe they were. Maybe that's the thing is that, real patients in real life, they're tricky. They're not cookie cutter, black and white. And so we're really trying to simulate that, actual practice. So the professors tend to be more responsive when students come just with accountability, like, hey, this is my part, this is what I can do differently. Most people that are not doing well on tests, they're not just missing one or two questions, they're missing, 15 or more questions. And so if that was the test, that would be a very big problem. But most of the time we're going to take accountability for our side. We're always looking at our tests, we're looking at our statistics, we're trying to provide a good testing experience for you. But on your end, at the end of the day, you have to take accountability, just like we are taking accountability for what we're doing. Working at JPS, one of the things I learned when I first started is the principle of owning it. And that means, like, hey, I own what I do. If I make a mistake, I have no problem admitting it, because guess what? When I make a mistake, I'm learning. And as long as I'm learning, I'm growing. That's what's really important in this. So take every counseling you do not as like a slap on your wrist or as an embarrassing thing. Your professor wants to help you. They want you to do better. Listen to them, try to see what you could do differently, and maybe you're going to have to get out of that comfort zone and do something you don't want to do. But you're looking at the crossroads. You either got to try something different or keep doing what you're doing, and it's obviously not working. So just take accountability, and there's nothing wrong with it. We all make mistakes. We all kind of are learning a lot of this together. So just don't be afraid to say, you know what, I think this is what I did wrong, and kind of see then, like, what can we do? Because we can help you most when you figure out what you're not doing or what you're doing wrong. Because if you just come to me and say, well, I got tricked by all the questions, how am I going to help you? The test isn't changing. The only thing that can change is you. So I really want just to reiterate that, we're here to help. But, you have to, do your part too. You have to put the work in. You have to be willing to look at what you're doing or not doing that's working or not working. And then take care of yourself, do something non-nursing related for at least 1 to 2 hours a week. So whether this is, spending time with a friend that's not a nurse, that doesn't know anything about nursing, that's not going to talk about nursing, or, spending time with your pets, going on a walk, exercising is great. The endorphins will make you feel a lot better. Do take up a different skill or something else, but do something that's non-nursing related, where you're not thinking about nursing, you're not thinking about your exams, you're not thinking about anything, but taking care of yourself. It's amazing how much, when you let go of stress, how much better things can be. And when you take care of yourself, getting enough sleep at night is so important. And it may seem like, oh, I'll sleep when I'm dead, but trust me, even getting a few extra hours of sleep at night can make a big difference when you're taking a test. Before you take a test, don't sit there and cram for hours. Don't study up until the minute you walk in that test. It's especially good that hour before the test to give yourself a brain break. You're about to take 60 questions or however many your classes back to back. It's going to be incredibly overwhelming. So remember, just give yourself a brain break. Don't stay up all night studying and cramming. Really try to space that information out so that you can really take it in. And whatever you decide to do non-nursing related, just make sure that it's something you enjoy. Like, don't sit there and be like, well, Miss Woodruff said I had to go and do something non-nursing related for at least this long, and then do it begrudgingly. Find something that you enjoy. Find something that you miss doing. After you graduate, you're going to find that there's so many things that you haven't done in forever, and be like, what did I used to do when I had a life? So start rediscovering some of those things that you're going to get back once you graduate, because you all are going to graduate. You're going to do wonderful. This is the end of the slideshow. I hope that this was helpful for you. I hope that you learned something new, even if you are already doing all these things. Maybe you learned something a little new. And you're welcome to reach out to me if you have any questions. Keep on fighting that battle. You're going to get through nursing school. You're going to graduate. You're going to get a license, and you're going to be awesome. And this will all be a bad memory. It's kind of like childbirth, where, we forget that it happened. For minutes, like kidney stones, it didn't seem that bad until it's coming back again. And then you have another kidney stone. So yes, or another child. So yes, but yeah, it's definitely hard when you're in it, but you're not alone. We're getting through this together, and use your resources. There's tons of resources through the Success Center, through your instructors, through your other classmates. So please feel free to reach out to me if you have any additional questions about this. And I hope you all are staying well.